We're going to be discussing patellofemoral pain syndrome, also known as runner's knee, the symptoms of it, what causes it, as well as what you can do about it. I'm Dr. Amy, PhD trained orthopedic manual physical therapist, and we are empowering women with changing bodies to move pain-free. And that includes women with patellofemoral pain syndrome. So first off, what is patellofemoral pain syndrome? To be fair, it's not the most accurate diagnosis. I don't love it super much because what it means is that the patella, which is the kneecap, has pain underneath it. So if you feel like your pain is underneath the kneecap, then yes, your doctor will diagnose you with patellofemoral pain syndrome. However, it doesn't explain how you got there in the first place. It's an accurate diagnosis of the root cause of the pain, but not an accurate diagnosis of the root cause of why that pain started in the first place. Because obviously your patella has been moving on your femur or your thigh bone forever, and it wasn't painful until. And we're going to get to what started that problem in the first place later in this video. Now, if you're suffering with patellofemoral pain syndrome or runner's knee, chances are good that you're having difficulty with stairs, with squatting, with things like sitting for a prolonged period of time, and people wonder, why is this happening? The answer lies in the biomechanics of the knee joint. So what happens is that the patella, the kneecap, sits on top of the femur, which is the thigh bone, and there's actually a groove that's in the femur that the patella is supposed to move into. And it's kind of a little bit of a curved groove, and it goes just like that as it goes in and out. So as you bend and straighten your leg, that patella is supposed to go into and out of that groove in the femur. However, what happens over time is that we may have abnormal muscle pulling or abnormal ligament pulling that causes that patella to get out of that groove, and it can actually run into the bone that's on the side of each groove. This leads to inflammation and pain. So if your patella is not moving in the groove properly, when you do a higher level exercise that's going to activate those quads, so think of stairs or squatting, it's actually going to cause a compression of that kneecap on that femur, which is going to increase the inflammation and your pain. If you do that in a repetitive manner, so you're constantly climbing stairs or walking around or doing things that are aggravating that joint, then it becomes inflamed enough that even when you're sitting, it will cause pain because that inflammation is now stuck sitting in that joint. Many people with patellofemoral pain syndrome actually feel better after they've been walking for a little bit because it's helping to clear that inflammation out of the joint. And it's more when they sit for a prolonged period of time or even stand, if you stand regularly throughout the day for a long period of time, that your symptoms will increase. Okay, so if patellofemoral pain syndrome is caused by a tracking issue of the kneecap on the femur or the thigh bone, then what is the answer? How do we solve this problem? We fix the abnormal tracking issue, which sounds pretty easy, but I'm going to talk you through that. The tracking issue is most commonly caused by one of two imbalances. The first one is that you are a quad dominant person. Let me explain. The quads are on the front of the thigh, and they do work harder than the hamstrings, which are on the back of the thigh. However, most people in our society today are quad dominant in that they work too much in comparison to the hamstrings. So the ideal is a 3-to-2 ratio, which means for every 3 pounds that your quads can do, which is knee straightening, your hamstrings can do 2 pounds. Which is knee bending. So it would be 3 pounds straightening, 2 pounds bending. What happens is most people can lift 3 pounds, but can only curl 1 pound. This is what leads to the imbalance. So for a lot of people, they think, oh, I'm having patellofemoral pain syndrome, I need to strengthen my quads, and that's actually the worst thing that you can do because that actually increases the compression of the patella or the kneecap on the femur or the thigh bone, which will increase your symptoms. Also, since you have an abnormal tracking issue, that is further increasing the compression of the kneecap on the femur, which causes even more inflammation and more pain. Which leads to solution number 2. So solution number 2 is making sure that patella or that kneecap is tracking appropriately. Most commonly what happens is that the muscles on the outside of our hip and knee become weakened compared to the muscles on the inside of the hip or knee. So the muscles on the outside are called the abductors, the abductors. The muscles on the inside are called the adductors, adductors. If the abductors, the outside muscles, become weak, then the adductors, the inside muscles, will become tight, which causes an issue because now the muscles on the outside are going to tighten up to try to fight against the muscles that are on the inside. So in this case, it's really important to strengthen the muscles on the outside and stretch the muscles on the inside. Now, if you're looking for some exercises that will strengthen your entire hip and therefore decrease the forces through the knee that are causing this pain, I'm going to recommend you check out this video over here. Now, some of these exercises may be a little high level for you right now in that they may actually reproduce your patellofemoral pain. In that case, please do not do these exercises at this point. It's really important that you do not do any exercises that increase your pain, especially right now, because if you're increasing pain, you're increasing compression, you're increasing inflammation, that's just going to make this cycle last longer. So check out the video, try the exercises, do the ones that you can do pain-free for now. You can add the other ones in later on once your symptoms have decreased. Now, a question I often get asked with patellofemoral pain syndrome or runner's knee is, when should I get help? And the answer to that is a little bit difficult because it's different for everybody. So some people want to get help right away. They have high-level goals. Maybe they have a race coming up or an important family event that they want to be able to fully participate in. Then I would recommend getting help as soon as the pain starts because you want to make sure to limit any damage and get yourself moving forward as quickly as possible. Now, other people want to take more of a wait and see approach. Let me try some of these exercises that I found on YouTube and see if this gets better on its own, which is absolutely fine. For you, I'd recommend try those exercises, stick with them for 2 weeks. And if you don't feel like your symptoms are on their way to getting better, I'm not saying they'll be fully resolved in 2 weeks, but they're not on their way to getting better, then I would seek help because those exercises, they could be fantastic exercises, but they're not working correctly for you. And that's the important thing, is finding the exercises that help your body, that decrease your pain and get you back to your goals. I often say exercises are neither good nor bad. They just might be the right ones or the wrong ones for where you are on your journey. What to do about patellofemoral pain syndrome. So we talked about what it is and why it happens, as well as gave you some tools that you can use to help decrease your patellofemoral pain syndrome. If this video is helpful, give it a thumbs up. Don't forget to click subscribe to get more content like this. And if you want to go check out those videos I recommend for your hip to increase your strength, decrease your patellofemoral pain, then go ahead and check it out over here.